Well, we try to tell the truth about what we see, and I certainly always like to tell the truth as I see it. And I talk about the fact that we have seen 80% of chronic disease when we can identify a start date, and that's not always possible, but when we can identify a start date with a disease, 80% of them start within 3 months of a vaccination event. Now that to me is a fact that needs explaining. Now in any single case I can't prove that vaccine has caused the damage, but when there's 80% starting within 3 months of a vaccine event, when only 25% should by chance, then something is happening which needs explaining. And until a better idea comes along, I am concluding that vaccine, generally speaking, can disturb the immune system sufficiently to start chronic disease on its road.
Chris, if we're not vaccinating, what do we do?
I never advocate doing nothing to protect animals. I don't want to see those terrible diseases back. I don't want any of my patients suffering those terrible diseases, so I advocate using homeopathic treatments. In fact, they're homeoprophylactic treatments, they're preventives, and we use nosodes for that. If I come out as I'm against vaccine, I'm only against the unthinking use of vaccine, and the reason I don't use vaccine is because I feel I have a valid alternative. And I would not ever advocate anybody leaving an animal unprotected. I don't want to see those diseases back. I've only been in practice 35 years, 35 and a bit, and I wasn't using nosode in the early days. I wasn't anti-vaccine in the early days, in fact probably more vaccine-minded than most vets, because I'd seen the time before vaccine as a child. And I was very convinced vaccine was the right way forward. So I never spoke against it until I felt that I had an alternative, although I had seen side effects from it. And I wasn't always delighted with the way the side effects were dealt with by the pharmaceutical industry or by the profession. I felt they were sort of, not talked about and certainly not reported commonly enough. And therefore the data isn't really out there.
As you know, I have had 3 dogs who I believe were killed by vaccines. And so I've done quite a lot of research into the vaccine issue, and what I see is that vaccines cause more diseases than they prevent.
My gut feeling is that we do have more chronic disease than we should have, and that it is more prevalent now than it was when I was young. And I believe that vaccine is possibly one of the components in that.
One of the main thrusts of Canine Health Concern is that although we say it's absolutely right that people should have the freedom to choose how they take care of their dogs, we know it's absolutely unnecessary to vaccinate every year. How do you feel about that?
I'm with that argument all the way, in that there is no science to support an annual boosting system. There's even less to support giving double boosters when an animal's lapsed vaccine boosters for a number of years. And some of the worst diseases we've seen following vaccine have been the quickest to come on and have been the worst to deal with when they've had double injections in middle life, when it's unnecessary. No, I mean, there is no scientific support for annual boosting that I can find, and as far as I'm concerned, it is potentially damaging.